Okay, let's discuss the head, eyes, ears, nose, and throat. A little anatomy first. Now, I'm going to show you this. This is kind of rudimentary, but this is a representative of the eyeball. Here we have the brown color, that's the iris. The inner side is the pupil. Over this area would be a clear covering called the cornea. In this front section here is the anterior chamber, and behind this would be the posterior chamber where we have humors. These humors keep the eye in and keeps its shape. All right. Then wrapping around the sides, the white would be the sclera. Overlining this would be the eyelids. And lining on the insides of the eyelids of a pinkish color or flesh color is the conjunctiva. Towards the back we would have the optic nerve and bundle. And what happens is when vision comes through this, the iris constricts and dilates, allowing the pupil to allow more or less light in, and then the objects that are visualized then are focused on the optic nerve, the retina in the back of the eyeball, and then it's interpreted into the brain. Facial bones and the facial construction. There are many facial bones that we need to be worried about. We have the zygoma, the maxilla, the mandible, the temporomandibular joint here where the jaw articulates to the skull and facial bones. You have this nasal bone here. A lot of this here is missing is the cartilage that sits in the front. And then the skull cap and the rest of the cranium. We'll also be evaluating other parts besides the head itself and the scalp, but the facial features, facial bones, the mouth, the nose, and the ears. Right, so common injuries to the eyes. Sometimes we'll get a foreign object into the eyelid or under the eyelids. What we want to do is flush this out, or using a Q-tip. We'll place the Q-tip here and then flip the eyelid over, and we want to try to flush this out. Same thing happens with the lower eyelid. We just place this Q-tip here, and then we would press down to observe and look under the lid to find the foreign object. If we can, we want to just continuously to flush that object out until the gritty and scratchy feeling has dissipated. Other things that can occur is actual injury to the orbit or the bone around the eye. And so we'd be careful to evaluate both sides to make sure they look symmetrical and in place. Other injuries can affect the eyeball itself, where a globe injury where the actual humerus has been penetrated and it's leaking out. We could have something that's still impaled, or the object or the eyeball could be protruding out. In this case, we want to make sure that we don't put any pressure on the eye, and we want to cover both eyes. This side, the injury side, we'd use some kind of cup, and the other side we would cover with maybe a 4x4 flap so that the patient can, if they need to, be able to lift it up to see. But what we want to tell them is that if you're using your eye, you're causing the stress on the injured eye as well. So we want them to feel as relaxed and as comfortable as possible, but we want them to keep their eyes closed and not to focus on anything. As far as the face and facial bones, we'll talk about some that the head, the face, and the skin, the blood vessels to these areas are very vascular, which means that they can tend to bleed a lot when we nick ourselves, cut ourselves, or injure yourself in any way. So what you want to do is put direct pressure. Keep in mind that any type of injury to the head could also affect the vertebral column that's coming out of here, the cervical vertebrae, so we may have some kind of spinal cord injury. Now let's get back to the facial injuries. A lot of times it's just contusions and bruises and hematomas that develop. But you could have some serious facial injuries. There could be an injury to this temporomandibular joint area, a fractured jaw. This would cause the jaw to be locked in place. The person would have a very difficult time opening and closing their mouth. especially if you were to put pressure on the mandible or have them open their mouth and then they were to bite down on a 4x4, and if you were to pull it, you would cause this separation, causing immediate pain in whichever side of the jawbone that has been fractured. Impalements, and sometimes there are impalements through the cheek tissue here. We may just want to kind of add a bulky dressing to build that up there, but a lot of times if there's not a lot of vascular space or issues, that may just compromise our airway, and it might be more advisable to contact medical control to decide whether or not you're going to be able to take that out so you can put pressure on both sides of the injury. But impalements. The other things would be injuries around the neck that's non-compressible. We have a lot of blood vessels. Our carotids, our external and internal carotids. We also have the internal and external jugular veins that drain any blood flow from the skull cap and cranium back down into the central circulation. In these cases, when we're putting pressure, we can't do circumferential wrapping of our bandages and dressings, so we're going to have to put some direct pressure to hold this area from and to mitigate or to impede the bleeding. I give a few last pointers here. Their ear injuries and epitaxis, so nosebleed. So a lot of times pediatric patients will tend to put things into their nose or into the ears, and sometimes even insects get into the ear canal. It's very irritating. They can feel it moving in there. Some cases we've been able to lay the patient downwards and then shine a light, and then for some reason bugs are attracted to light, they tend to come back out. I've heard other things where we try to use some aqueous solutions such as like a mineral oil to then suffocate the animal and then allow that buoyancy, the heaviness of the oil to cause displacement of the insect. The only problem is that we need to be careful about whether there was any penetration through the eardrum. So a lot of times this type of treatment is done in the hospital. Epitaxis, when we have nosebleed, basically it's because of some type of external trauma. Pediatric patients or people putting things into their nose, they're going in from a humid environment to a cold environment, humid environment, cold environment, causing the blood vessels to expand and dilate and then contract. And when they dilate, they engorge themselves. These blood vessels are quite superficial and they rupture. When it's a simple epitaxis, we just want to pinch the nose closed, have them lean forward. You may put some ice compress over this area, as ice causes shrinkage of these blood vessels and decreases blood flow. They would have to pinch this nostril close and make sure that there's no irritation or that they're not trying to blow their nose for at least 15 minutes. This takes a lot of time for them to kind of clot off and occlude those soft blood vessels that have been ruptured. The only time that this becomes more significant is that if the person is also has a high blood pressure. So when we're having a high blood pressure incident, and sometimes it may be a hypertensive emergency, the patient may also complain about other symptoms like a headache, feeling there's like a lot of pressure, and then all of a sudden they had an epitaxis. If you notice that the blood pressure is above the 200s in systolic or above 110 diastolic, and they're having this this epitaxis in conjunction with that, this may not be just a simple epitaxis. This may be a medical emergency that may require more management. Please review in your books.